Right. It's right at the top of the hour. Hello and welcome. My name is Anafi Mataga from ASLM, and I'm delighted to be your host today. This is the September 2020 monthly LabCoP session, a session that we have dedicated to sharing best practices along the viral load testing cascade. As you all know, back sometime last year, we met in Addis, and we relooked at our cascades. And one of the key things that kept on coming was us lacking in terms of creating enough demand, as well as utilizing the testing that we do for viral load and EID. So viral load utilization and demand creation continue to be our key priorities. And particularly during this time of the pandemic, creating enough demand to ensure that testing continues becomes paramount. Hence, we continue to hold hands with our colleagues from the International Treatment Preparedness Coalition, ITPC, to make sure that we do not lose the gains that we have gained over the year, particularly in the fight against HIV, TB, and as well as malaria. So demand creation depends on several pillars that includes patient education, sensitization, and awareness. And to help us unpack this important topic, we have Ponso Pilane, who is a media consultant, a lecturer, and a trainer with an interest in health, race, and gender, and how all these intersect. In this session, we will discuss how communication strategies can be developed for advocacy campaigns, the use of digital media to create unforgettable campaigns and messages that are impactful, as well as innovative strategies to produce results and make messages clear. I want to remind you that this session, as usual, is going to be 1 hour long. We shall have the first part as a presentation, as well as some engagement along the way. Please keep your questions and put them into the chat box as the session goes, and we shall attend to them as the session continues. Gentlemen and ladies, let me introduce to you Ponso Pilane. Ponso, over to you.
Thank you so much, Anafi, for the introduction. Good afternoon, everyone. As Anafi said, my name is Ponso Pilane. I am speaking to you from South Africa, and I've been working with the International Treatment Preparedness Coalition, ITPC, for the past few months, as well as with the ASLM for how to strategically use communications in advocacy campaigns, particularly around advocating for or increasing the awareness and demand and knowledge for routine viral load testing. And so my short presentation will really be around some of the ways in which you can use in your personal capacity, as well as within collectively, as well as within your organizations, how you can use communications as a tool for change and advocacy, particularly for routine viral load testing. In this presentation, as Anafi has said, I will look at how I will discuss developing communication strategies, how we can use digital media. As we see right now, we are having this over Zoom because of the global pandemic that we're all facing. And therefore, digital media becomes a very important tool in the dissemination of information. And then we have to rely heavily on digital media, as many countries are still in restrictions of movement. Therefore, the digital space becomes an arena for us to continue the work that we do so that we meet the targets that we want to meet through the work that we do. And also how innovation and thinking out of the box can produce and make our messages clear. In this case, the main message is that we're trying to communicate the importance of routine viral load testing with the intention, or with the larger intention, or the greater intention, long-term intention of increasing demand and turnaround time and so forth. So to contextualize this issue of communications and where it can fit in with routine viral load testing. I'd just like to give you an overview of what's soon to kick off in 6 different countries, the hashtag Know My Viral Load campaign. So I'm sure previously some of you have been aware of the hashtag Know Your Viral Load campaign. When I came on board at ITPC and I was given the contextual history and why we are trying to do this campaign, I thought, and with discussion with other people at ITPC and as well as the organizations that will be implementing in the 6 countries, we decided to change the hashtag to Know My Viral Load. You might be wondering why. This is primarily because we are trying to personalize the importance of routine viral load testing. So it's not about know your viral load. It's not a conversation that someone else must have, but it's really a conversation that I must have or I must consider if I'm a person living with HIV. So by changing something as simple as your to my, we've already begun the process of making the campaign more impactful. And essentially this campaign, we are trying to create an impactful campaign that will result obviously in heightened awareness about routine viral load testing for people living with HIV in these 6 countries where the campaign will be implemented. But the ultimate goal or the longer term goal is to increase uptake in our VLT and to have a quicker turnaround time from health workers. And this is something that came out in the trainings. A lot of the organizations that are working on the ground raise this as an issue that, yes, we, in some stakeholder circles, it is very clear, people understand clearly the importance of RVLT. The problem we're having is that we do not get results on time and so forth and so forth. And so it is within this context in which I will depart to tell you more about using communications as a strategic tool for social change. Furthermore, like I said, we are currently in a global pandemic, and this has resulted in us not being able to meet physically. And when you think about the digital space as maybe a room, right? Think about us being in one sitting right now. And the fact that within a minute of me speaking, your attention might be split in different ways. Your phone, you might receive a WhatsApp text on your phone, an urgent work email that you have to attend to. You may be scrolling through Twitter or something else. And this graph, and this is what we call, this image is what we call the Internet Minute. Every year, researchers release this to show what happens in 60 seconds on the internet. The reason I'm sharing this with you is to contextualize the competition or the competing ideas that exist within the digital space. So yes, you're listening to me, that's great. But if a message pings, it distracts you. What I'm trying to say is that when we are when we're trying to communicate, particularly for advocacy reasons, we need to be aware that we are communicating with people, ourselves sometimes being the recipients or the target audiences of campaigns, with people whose attention is split in many different directions, and therefore there is a competing things or topics or things for our attention. And this is something important that we have to have and consistently think about. We have to think about this particularly because when we want to reach our audiences, particularly digitally, we don't know how long we're going to be in this pandemic where we cannot reach the stakeholders or the constituencies that we work with directly. Therefore, when we realize that digital platforms are always changing, and will continue to change, the ways in which we as audiences or people who want to reach audiences consume the news, interact with the news, get information, are entertained, is something that is ever changing, and that we as people who are trying to reach certain demographics, certain groups of people, we need to be aware of this. And this has forced us mainly to communicate on different platforms, and also tells us that we need to communicate in ways that we are able to engage our audiences, that results in change. And to do so, it's important that we also realize the context in which we are communicating. We're mostly on the African continent, and when we look at the internet penetration and social media penetration, which are the most ways in which we reach people during a time like this, we see some of the figures there where in Central Africa, it says 12% internet penetration, which means that we cannot completely rely on digital technology to reach our constituencies because they're not necessarily there. When we know what it looks like or how people or the target audiences that we want to reach use social media, use the internet, or use their phones or different kind of other media, we are able to contextualize or choose the right platforms to which we want to communicate with them. And the way we communicate with them also matters, and that we will get onto that a little bit later. Just a global overview about what the digital world looks like. And we have so many, we have a total population of about 7.75 million people, and about 70% of those have mobile phones. But having a mobile phone does not necessarily mean having internet access or having access to social media. Again, the importance of this context when we think about why or how we want to communicate and who we are communicating to. And this specifically is an overview of what the digital world looks like in Africa, where we see about 1.3 billion people, about 1 billion of them have mobile phones, but only about close to 500 million of them actually have mobile phones that use the internet or access the internet. And about half of that is on social media. So these numbers I'm sharing with them so that the wheels start turning in our heads around how we reach people that we want to reach. In this case, when we're talking about RVLT, we are often talking about reaching people living with HIV in rural or urban settings, and therefore it's important for us to know the lay of the land, essentially, so we are able to choose the right platforms and the right manner in which we want to communicate with these people. And so throughout, I just wanted to give you context. I'll be using a specific example of a campaign that I worked on, I'm still working on because it's ongoing, of how a successful campaign can go. The campaign is called FreeToBleed. It started in October of 2015. And essentially the overarching demand for the campaign is to demand the government of South Africa to make sanitary pads free for all menstruators in the country. And it used digital campaigning, petitioning, the lobbying of parliament, as well as communications as a strategic tool to get public buy-in. And its first major win was in October of 2018, and it is an ongoing campaign. And I'll explain a little bit to say why it's ongoing. There are different objectives that the campaign has. The overall one is to make sure that pads are free in South Africa to those who need it. That is a very long-term, broad goal. For example, we are sitting here in this room right now, and our main goal in terms of RVLT is that every person living with HIV goes for the routine viral load testing every year and is able to get their results, and they know whether the virus is undetectable in their system. That is the overall or long-term goal of trying to advocate for routine viral load testing. That is not something that will happen with one round of implementation. That is the bigger goal. And so it's important to know what the bigger goal is and also then create steps to reach it. There's often a saying that says, how do you eat an elephant? And the answer is one bite at a time. And so with campaigns, it's the same way as well. We have to have bite-sized chunks or take small bites of the bigger picture in order for us to be able to reach the goals that we want to reach for the communities that we serve. When we are doing a communications campaign, or when we're planning or strategically planning communications, there are 5 main components that we need to think about. We need to think about the first step we need to go about is identifying our audience. This is the people that we are trying to communicate to and with. I say to and with because in many instances, you want to communicate to a certain group of people or communicate with them. So sometimes you want feedback from them. It's not just a one-way or what we call a hypodermic needle, where you just receive a message. You want to create interaction in order to measure. The second step is also to determine goals and objectives, why we're communicating with them. For example, we know that with the routine viral load testing that what we want to do, our audience is people living with HIV primarily, and we want them to go for their routine viral load testing every year. And the second step is that we need to develop key messages. What is it that we want to communicate? In this case, we want to communicate the importance of RVLT and why people should go for their viral load testing every year. Once we know the first 3 steps, then we are able to actually start a content plan. This is the messages that you're actually going to communicate when you're going to communicate to these people, the audiences that you've chosen, and how you're going to do it, which platforms you're going to use. This is the hardest and often most complicated step of the process, but we'll go through it step by step. And obviously we want to measure or evaluate our campaigns. We want to see, or we want to make sure we know ways in which to see ways that which we are successful. Identifying our audience is the first step. So it's quite easy when we're talking about routine viral load testing to know what the general sense of our audience is. In the 6 countries where we were doing the training, everyone was more or less saying that they want to reach, in general, they want to reach people living with HIV. And specifically, some organizations work with young people, so they want to reach young people. Some organizations work with expectant mothers, so that's the population that they want to reach. But the umbrella term that we can use for this group of people is essentially people living with HIV. And on an organizational level, we are able to then go into details about this audience. It's important that we think about certain things when we consider certain issues when we're thinking about our audiences. One of the things that we need to consider is where we're going to reach them. Which communications tools are we going to use to reach our audiences? Because we can, thinking about, again, the global picture. So in Africa, it's not necessarily the digital platforms that are the best ways to reach people. However, we could reach more people via mobile phones and sending SMSs. Who are we speaking to? This example is based on the FreeToBleed campaign, because I'm trying to show what a successful campaign to the end looks like. So with this campaign, we were targeting, our audience was concerned citizens, parents, and young people, because those are people who are usually within their menstrual cycle. The parents are the ones who usually bear the cost of buying the sanitary products, and concerned citizens, because sometimes you might not be affected by something, but it's something that you support because you're an aunt, you were a poor learner once, and you did not have sanitary pads. So it's always important to identify your audiences and understand the context in which your audience exists in. So it's not necessarily that your audience is always just going to be the people who are affected by an issue. They can be allies, or they can be other people who can make it easier to reach for you to reach your objectives that may be involved. And lastly, where you will engage these people. We must always remember why we want to have a communications plan. And this is just a nice summary of what a communications plan is and why we use them. We are putting together steps step-by-step way in which we're going to deliver a strategic message. In our case, the strategic message that we're trying to deliver is that routine viral load testing is important for all people living with HIV, so that we also to drive a positive. In the business world, we'd say a business outcome, but in the advocacy world, we'd say just positive outcomes. What is that positive outcome when we think about our situation? That positive outcome is we can often refer to it as creating the demand and also making sure that routine viral load tests are returned on time. So once we know that, then we need to be able to determine the goals and the objectives of our communications plan. And I'm sure many of you have heard of the SMART goals, or making SMART goals and objectives. So the ones in the red are for the FreeToBleed campaign, and the ones in the blue are for the routine viral load campaign, routine viral load testing campaign. So the most important thing is that our strategic objectives for our communications plan needs to be specific, must be clear and not vague. So for example, with the FreeToBleed, we want all menstruators to get free sanitary pads from the government. And with the RVLT campaign, we want people living with HIV to know about RVLT and then to demand it in their health facilities. Our objectives and goals also need to be measurable. They need to be able to help us measure whether or not we're successful. So we are talking about how we're going to measure success of our campaign when people living with HIV, for instance, start demanding routine viral load testing. And they also need to be attainable. This means that they should be within our reach. And when we're thinking about communications is one component of having a successful advocacy campaign. It's one of the pillars that matters, but it's not the only pillar that is required for a campaign to be considered successful. So what can communications contribute to the larger picture? It can contribute the fact that we can create awareness and inform people living with HIV, health workers, and people within the process of routine viral load testing, the importance of RVLT, so that the demand increases. But it also needs to be realistic and time-bound. Being realistic and time-bound usually go together, because something cannot be realistic if you do not consider how long it might take to win. So for instance, in the FreeToBleed campaign, in 3 years, we wanted to make sure that the South African government was at least giving pads for free to learners in the poorest schools in South Africa. And with the RVLT campaign, in the 3 months that the organizations will have for implementation, we want people living with HIV to know the importance of routine viral load testing. So there's a time bound, there's a clear deadline to achieve these two goals. Specifically, if we're looking at the RVLT goal, is that at the end of the communications campaign, we need to be able to, people living with HIV, whether we have a specific constituency or not, need to know the importance of routine viral load testing. And once you're able to determine what your goals and objectives are, they help us understand our audiences better. They also help us identify which platforms we're going to use to communicate with our audiences. And also it helps us to contextualize the importance, or how the information that our key audiences and stakeholders can get from us. It also helps us to consider where and how they would interact with this information. All these steps help us also determine how exactly we are going to communicate to them in order to raise their awareness on routine viral load testing. When we think about communication strategies, it's also very important to think of why we're doing them. Are we trying to engage people for education purposes, or to communicate, or for both? In many campaigns, we're trying to do both educating, which is the awareness building, but we're also trying to communicate a specific a specific message. So in the case of RVLT, what we're doing is we're educating, or we aim to educate people living with HIV on the importance of knowing their viral load and why it matters to them. But we also want to communicate that they have the power to demand it in health facilities. Once we know this, we are able to determine the outcomes and what and how this will affect the way in which we implement and whether or not our communications plan will be successful. It is in answering these questions and asking ourselves why we want to communicate and in certain ways that allows us to know, to eventually possibly think that of ways in which it can be successful in the end. I'm now going to play this short video. It's about a minute long and it has subtitles. So I will play it, and because I want us to think of a few questions that we'll discuss a little bit later around impactful campaigns. This is a routine viral load campaign that ITPC took part in last year. So I'll just play it now. I'll play it for the first time fully, and then I'll play it again just so that for the sake for translation, so that the translators are able to translate for our French-speaking colleagues.
HIV nearly ruined my life. I thought my future is completely shattered. But through viral load testing, it has been resurrected. There are people out there in the same boat which I was at first. And I would like to encourage them to do what I did. Please, I urge you, it is your life. Take chances.
So just for the sake of time, I won't take questions now, but please feel free to think about going through these questions, thinking about these questions, and we'll discuss them in a minute as I start to wrap up my presentation. So watching that video, you know, just to give a summary, because I'm just cognizant of time for our French-speaking colleagues, this is a 1-minute video about this man who did not really, who thought he was going to die because he was HIV positive, but he then knew, after being cancelled, he knew the importance of taking his medication and the implication of taking his medication on his viral load. And then he's encouraging other people who may be living with HIV and thinking that their life is over, why it is important that they know their viral load. And so I would like us to consider some of these questions. What was impactful about the campaign, or the video rather? Did it adequately show the importance of routine viral load testing? How could we make it more impactful? What we liked and what we didn't like. You're free to use the comment section to just share those, and we will talk about them more after I wrap up. Just to move on to the third step, developing our key messages. What do we need to communicate? Like I said, it is the digital age, and a lot of our communication will happen digitally. However, it is important for us, when we know our audiences, we know how and where to communicate. When we develop our key messages, we need to think of short, catchy statements that can pull that can attract the attention of our audiences, our target audiences. So something like a hashtag know your viral load, or know my viral load. These are simple ways in which we are able to create a message that people will remember when people see hashtag know my viral load. Or for example, the campaign that I shared earlier about FreeToBleed, something catchy, something that rhymes, something that's easy for people to remember, so that people, if maybe, like I said in the beginning, a lot of the times people have competing ideas online or even in real life. So we want something that is easy, that rolls off the tongue, that people can remember, so that we are able to create everlasting memories in people's minds, so that maybe they didn't have time to watch that 1-minute video when it was playing because they were in a meeting, but they remember it after the meeting and they want to watch the video to see if it's impactful. Or perhaps they don't remember anything, but the hashtag itself gives them all the information that they need. So it is very important to find catchy ways to say or communicate your campaign. And then it's also very important that we make use of good content. We want to create good content so that we reach our audiences and hold their attention, and we're able to tell our story or the story of the stakeholders and constituencies that we're trying to reach. But at the end of the day, good content is content that people engage in. If people are not engaging with your content is not good. It's missing something that people want from content. And again, these are different examples. I've mixed the FreeToBleed campaign as well as the RealT campaign to show you, using a hashtag and consistently using. We started using this hashtag in 2015, and till this day, when you search this hashtag, even other campaigns across the world that have adopted, that are also fighting for sanitary pad rights in their countries, have started using the FreeToBleed hashtag. Easy, understandable, and you're even able to grow a movement. Other ways that you can create content is through mailing lists, personalized mailing lists like this one. You know, we're talking about good content. When you refer to someone with their first name, there's there's technology like MailChimp where you can create newsletters and SMSs that mention people's names specifically. This often makes people feel special and that you're talking to them directly. It's not a campaign about those people. It's a campaign about asking for action from them, which is something you want to reach or you want to get out. Again, another example of a post that uses punchy words to get the attention of people. We're looking at here, getting people to be on a webinar. It's not very easy. People have what we call virtual meeting fatigue. How do you encourage that? You make it easier for people to make it easier on the eye. So it's not too busy, it's short, it's sharp, but it's impactful. And you put links that are also easily memorable. If you look at this link, it's what we call a customizable link, a customizable link here, where HIV 2020 children. So maybe the person did, maybe I won't remember the full website, but I'll remember parts of it, and that helps me still stay in touch. We want to think about these campaigns in a way that we want to make it easy for the people we're trying to reach to stay in touch, to go into to action something, to do something. So we need to package our messages in a way that makes it as simple and as pleasurable as possible for our target audiences to engage with. Here is also other ways, just a simple, straightforward message about the importance of viral load testing. This is from the campaign that was done in 2006. And again, this is another example that we took from the viral load training that we just did. Now that we know who we are communicating to, why we're communicating, how we will communicate, it's also important for us to explore what we will communicate. We have a hashtag and we have a generic key message. Our key message is to people living with HIV. We want the message to be that they need to know their viral load for their health. If we're reaching, let's say, sexually active people living with HIV, for the health of their partner, if we're reaching pregnant women, for the health of their unborn children or their breastfeeding baby, or so we want to contextualize our message specifically to the group of people we are reaching. And we also want to explain why a viral load test is important. And we want to end our messaging with a call to action. Go to your clinic, demand your VL test today, and then you use the hashtag. So these are ways in which you can craft messaging that is also a call to action, that encourages people. When we're developing key messages, like the ones that I've shown you, we need to make sure that they're sharp, they're focused, they're simple, they're targeted. We're reaching you. So it must feel like if a successful key message or campaign has messaging that feels like people are directly talking to you. And once it's targeted and powerful and is able to be agreed upon by a group of people, that is how you know that your advocacy messages are impactful. And lastly, we design the communications plan and the content plan. This is where we put the messaging, where we think about our budget constraints, where we're going to communicate. Are we going to communicate on Twitter? Are we going to use email? Are we going to use WhatsApp? Or which are we going to go on radio, because a majority of the constituency want to reach, listen to the radio. If, for instance, with people living with HIV, if you're trying to reach young people living with HIV, your best bet is Twitter, WhatsApp, and Facebook in most parts of the continent. But if you're trying to reach perhaps mothers or sex workers, you need to reach, let's say, key populations like sex workers and men who have sex with men. Those are stigmatized key populations. So perhaps you need a closed environment like a WhatsApp group or a private Facebook group to reach those people in a space where they will feel safe. Perhaps you even want to meet them in person because you understand that meeting them in person is more impactful than talking to them virtually. And these are all the things that you need to think about. Also, you need to create a content plan. What you're going to communicate, to who you're going to communicate, when you're going to do it, and also somebody who will be responsible for it in your organization. This is just an example of a mock content plan. This is one that's filled in. So you would fill it in this way. You know what your objective is, it's right there. So you're trying to create awareness for VLT testing. You want people living with HIV to know the importance of VLT test, routine viral load testing. You have your hashtag, which is normal viral load. Let's just do the first one for the sake of time. So the key message that we want to communicate is, it is important to know your viral load because it tells you how well our HIV medication is working. That is a message that perhaps you want to target to young people. You choose the delivery platforms or the platforms where you're going to reach them. Like I said, Twitter, Facebook, WhatsApp, radio, using influencers or key or peer educators. These are the materials that you're going to need. And you also need to consider the cost implications. And you do so for every target audience that you may have. Again, examples of content to show what a message, that once a message has gone through all those steps, you tag the relevant organizations as well that you know will help you with this. And this is ways that, these are things that you need to consider when you're crafting your messages. You can also use WhatsApp, use elements of emojis and certain things that make it attractive to use WhatsApp for. So these are just examples, again, of what it looks like when you've created the content. And the final step is measures of evaluation. How do you measure whether your campaign was successful? As I said in the beginning, communications is one pillar of a successful advocacy campaign. It's an important pillar, but it's not the only one. We need to be able to evaluate whether our messaging was successful. However, there are limitations to what our messaging can achieve. Our messaging does not necessarily always result in action, which is the longer term action that we want, such as increasing the demand for VLT in facilities. However, we can use a campaign like this one to measure the potential success for demand. How we do that specifically on digital platforms, we can look at what indicators like reach. If we've reached 233 people for example, if our post has reached 233 people, we're able to project or to estimate how many other people will be, how many possible people would perhaps ask about routine viral load testing. A lot of people in campaigns like this are also very interactive and ask a lot of questions. We should be able to, these indicators can tell us if we see the likes, if we see the engagement is usually comments and sharing. We can see the people who are engaging in our work and what they're saying with it. This can also be in the form of using some, quoting them in reports for donors or reports on impact, that somebody said, I'm going to tell my mother about this, she's living with HIV. You might not be able to know if that mother is going to end up testing for her viral load, but the fact that someone's like somebody has said, has engaged with your material, considering how much more things are online, is already an indicator, can be an indicator of success. But there are limitations, like I said, to what communications alone can do. And therefore that's important when we think about campaigns. We are lobbying governments, we are lobbying influential people, policymakers, decision makers. It's a complete process, and this is one element of a larger picture. Again, this is another way that you can see if whether you're messaging, the way you're communicating with people is reaching them in a certain way. This is all free. You can see it on Facebook. The same thing you can do on Twitter. It can tell you whether people are interacting with your tweets, how much they're interacting with your tweets, as you will see, and whatnot. Other indicators of success are, for example, with the FreeToBleed campaign, the fact that the government zero-rated pads at the end of 2018. That was the first major victory for the FreeToBleed campaign. And even though it is not the main goal, but this is one step, and part of having monitoring and evaluation is for you to be able to evaluate periodically, even before you reach your main goal. And with that, I'd like to just end the session. I know I'm a little bit over time and I've taken some of the interaction time, but I will now open it up for any questions or comments as I catch up on some of the comments that I see in the chat box. I see.
Thank you very much, Ponso, for the wonderful presentation. And thank you all. We see quite a lot of interaction coming through the chat box as well. So we really appreciate that. Maybe by way of kickstarting the discussion, there are also colleagues from Uganda, there's Victoria, has also shared some comments. Victoria, you want to kickstart, I think, responding to some of the questions that were in the video.
Thank you very much, Anafi. One of the questions that was posed after the video was played was the video impactful? And I would like to say maybe it impacted the person who was passing on the message, because he said he's now feeling well because of the viral load. But when you look at the video, it clearly doesn't show where he's coming from and where he's going. It only shows us a village background, to people fetching water, and you cannot relate the content to viral load testing.
Thank you so much, Victoria, for that feedback. So, you know, again, it goes back to targeting. ITPC is an international organization. It works mostly with grassroots level organizations. Therefore, there are limitations in how specific you can get with budgetary constraints. For example, with the training that we did it in 6 countries. Not all those 6 countries, or there's not enough budget to be able to, let's say, shoot an advert or a video for all 6 countries in a specific context. So as well as, and that's why we do communications planning, to say, with the limited resources that we may have, how can we create impactful campaign? So having an HIV positive man this specific advert or video was for men living with HIV, who we know from research and with the experience in doing the work in communities are a very challenging demographic, and therefore contextualizing it around, making it general enough but still unique in terms of it focuses on him and the importance. And you will remember, and I think I'll just go back to the video quickly. The video does two things. It uses two media to communicate with us at the same time. As the video is, I'm just gonna mute it to show you. He's speaking, you're being introduced to him, and he's talking about how HIV he thought HIV was gonna ruin his life and that his life is over. We're seeing what he looked like when he was extremely sick. That means, at the same time, these the bolder words, these ones here, are telling us, sorry about that. They're telling us, what did I do? Sorry about that. They're telling us more about what he's saying. And so it's this multi-pronged approach to communicate. You are trying to educate, but also communicate to the constituency. And sometimes it's with limited resources. That's why I was saying that there's only so much that could happen, that one can do in the group. I see Brown also saying one missing line in the video is how to connect our VLT to good health. I'd propose a line where the man in the video says, I did not know what was the problem until the day I got the VLT result, which revealed that my ARVs were not working anymore. Exactly, yeah. Brown. So finding these ways of making the message clearer, knowing exactly what it is that you're trying to communicate. There's a question again from Michael.
Yeah. So there is, maybe if I may jump in there as well. I think on the same point, I think Priska also says, is it advisable to come up with a new and unique catch phrase or hashtag? I think she's talking about the context in country, or to adopt or evolve the successful catchphrases from our campaigns on viral load demand creation. I'm raising this because you talked about context, also picking up from what Victoria had said. I think as you respond to that, maybe we may also bring in Brown. I think his hand was up a few minutes ago. So maybe you can go ahead and respond to the question of maybe making the issues of context come through, as Priska has mentioned.
Thank you, Anafi. Yes, context matters. So, of course, if you have a winning formula, you do not change it. However, you want to, because there's also fatigue, right? So maybe people get tired of, again, because we are bombarded with so much information online and in our lives in general. Sometimes we want to ensure that there is a new edge into our campaign. So something, not completely trying to reinvent the wheel. For example, what we did this year with the campaign, instead of completely trying to come up with a new hashtag, just changing one simple word can reinvigorate the campaign to be more impactful. And it's about also ensuring that you have contextualized a campaign into the reality of where you're working. So for example, if you're working in a community where English is not the main language, for example, when we did the training in the DRC, it came up, we've only used one, with the other 5 countries, we only used the English hashtag. But when we came to talking to our colleagues in the DRC, they raised the fact that firstly, even if the hashtag is in French, that's not enough. They need to have the hashtag in Lingala as well as in Kiswahili, because the constituency or the communities that they serve speak those languages. And so we had to spend a bit of more time than we did in the other 5 countries adapting the hashtags to the demographics. So we are not trying to fit our communities into our plans, but we're trying to fit our plans into the communities that we serve, because that is the only way, when things are culturally relevant to the communities that we serve, that they become impactful. I'm seeing this question around from
So
Michael.
maybe let's, before we move to Michael, maybe let's take, there are also comments that are coming in French, and thanks Pascal for the translations. I just wanted to pull out this one from Amina. Thanks Amina for the comment where she said the video is very touching. It shows that everyone can demand and need a viral load. However, it might be important to show how we can obtain the test. So as we move to Michael, I wanted to bring Brown back. Brown, are you there now?
Yes, Anafi, I'm here.
Yes. Yeah, so your hand was initially on. Did you want to speak to what was in the comment or something else?
I wanted to just highlight the comment that I put forward in the comment in the chat box. Fortunately, I think Ms. Pilani picked it, so she has addressed it. But otherwise, aside that, I wanted to commend this the topic of today. I think it was really relevant. We've enjoyed the topic. It was necessary for us to talk issues around communication and being strategic in reaching out to the communities that we are working with, specifically the peer HIV community. So kudos for the presentation, Ms. Pilani.
Thanks a lot, Brown. Yeah, and as Michael has mentioned, when and how do you know that this campaign is or was a success? Highlight briefly on the indicators of your track and how you can collect this data.
Thank you, Michael. That's a very important, question, because we can have campaigns, but if we are unable to measure their success, we do not know whether we are successful. So again, with the, and I'll contextualize with the FreeToBleed campaign, because with the new RVLT campaign, we are yet to begin implementation and then measuring success. But with the FreeToBleed campaign, there was a multi-pronged approach to it. So we were lobbying champions within government, we were lobbying champions within affected communities like young people who were either getting infections or that their quality of life was reduced because they didn't have pads in their lives. We were also using the media as a strategic tool. So calling a lot of radio stations, national newspapers, and even regional ones to ask for space. And that is how we measured our success. The more stories, I can tell you now, when we began the campaign in October 2015, people did talk about sanitary pads, but we can say that between 2015 and 2020, in the 5 years that we've been running this campaign, public discourse around sanitary pads and the importance of sanitary pads has increased this much by tracking things like Twitter, Facebook, the hashtag itself, but also tracking what becomes the news in the South African media landscape. So these are the different ways that you can track or indicators of success. And different indicators mean different things. For example, you can also have a petition. Our petition got over 5,000 signatures in less than a year. That is an indicator of success in one way or the other. How communication becomes an indicator of success, you need to know what you are trying to say was successful. For example, a communications campaign like this, getting a retweet could mean that someone saw your tweet and engaged in it. That means they read it. There's also other indicators of success. For instance, if like a video like this is on YouTube, YouTube starts measuring what they call a view. That means somebody has watched the video after 20 seconds. So you know if you have 15 views, for instance, or let's say 1,000 views, that 1,000 people watch your video beyond 20 seconds rather. And you know how much information you provided before 20 seconds. So you're able to say 1,000 people were informed about the importance of their routine viral load. That does not mean that they are going to go test for it, but you have informed them and you can measure the success that you have informed them. Then you need another strategy to ensure they leave their house and go testing. A communication strategy alone won't do that. So I just hope I'm explaining how the communications part of it, what the actions mean as compared to what the other actions, particularly maybe with the longer term goals of routine viral load, of demand, increasing demand.
Thanks again, Ponso. Another interesting question from the chat box from Dasema Uluka. He or she says, thanks a lot for the excellent presentation. Sometimes our communication for alert may create panic on the target. How could that be alleviated in the response?
This is very true. And I think COVID-19, Dasema, is an example of how we can create panic, right? If we do not communicate messaging in a certain way. So we do not create, what we want to do is offer solutions. So when we are highlighting, a lot of the times in our advocacy campaigns, we are highlighting a problem. There's an issue, there's a problem statement. It's more like doing research, or there's a problem statement that we state. Once we know what the problem statement is, through the communication of our campaign, we offer solutions. So the way we do not cause panic in our targets is offering them different solutions. So with the routine viral load testing, for example, if the problem is that a lot of health facilities do not offer it up to people, the solution is go to your facility and demand it. So you're not just leaving people in the lurch where they have this problem where they don't know their viral load. You give them information that will empower them to change the situation together with you. So yes, your local clinic does not offer viral load testing, but you as a citizen have the power to demand it. Go to your facility now and demand it. So you highlight the problem, but you offer solutions so that your target audience is not panicked.
Okay, thank you again, Ponso. A quick question from Raphael Langat. I think he's interested in the composition of the text message. He said, thanks, Ponso. How did you work in composing, I think, the composition of the text message with people living, people with HIV?
I'm not quite clear on the question, so perhaps I can unmute and just explain the question more so that I'm able to answer it sufficiently.
All right. As we try to find Raphael, I think I also want to mention that we are working with ITPC and country teams to actually help them sort of create these messages as Raphael probably is asking. Raphael, quickly, in 30 seconds, can you quickly just expatiate what you meant? All right, you are unmuted. Well, that's looks like I think Raphael is not connected because of time. I think we want to move on. Just kindly reminding you, as you can see on the screen, Ponso has put a mock plan, and this is something that is actually being worked out with certain country teams that came forward to produce such messages and such videos, and hopefully we can be able to track whether these have been impactful or not impactful. If not, we can then try to see how best we can improve on this. I know we are now at the top of the hour, so I think it has been quite an interesting topic, and I also saw quite a lot of interest in the example that you gave, Ponso, particularly around sanitation pads, and people like Temugeni really coming in with important comments, such as countries taking key priorities and reallocation of resources. Whilst this may not be directly related to HIV, but it is also important, affecting also people living with HIV and everyone else. So we appreciate those comments coming through as well. Ponso, in just 30 seconds, can you kindly just share with us some closing remarks?
No, definitely. I think you know, communications is a very important tool, and we should be able to use it to our advantage by thinking about ourselves as well as target audiences, and not thinking about our target audiences as people who don't have interests like us. So communications is a tool that is often very easy and it's affordable to use. You don't need a lot of budget, and we should be able to use it in our personal and in our organizational capacities. Thank you so much, Anafi.
Thank you, Ponso, and thank you everyone for the active discussions that we've just had. An important subject indeed. We need to make sure that all these innovations that we have are being utilized to save humanity. I just want to also remind you that we continue with our special COVID-19 sessions, and we shall be having the next one on Monday, where we will be giving you results of independent evaluations that have been done for most of the tests, particularly the rapid diagnostic test kits, both antibody test kits, as well as the antigen test kits, courtesy of FIND and their collaborators. So please watch out for the advert. It's coming soon before the end of the week, and we hope to be meeting you there. I think with this, I would like to say on the screen is details of how you can go to the ASLM Academy page and be able to download your certificate. Please note this session will be uploaded within a day or two, but you will be free to be able to access all those other sessions that have been held in the past. Till we meet again, good morning, good afternoon, and good evening. Bye-bye.